Hey, you're listening to WSCA 106.1 FM. It is 12 o'clock on a Monday, which means it's time for Seacoast Business Connections Radio Show. I'm your host, Mark Miller. I'm here with my co-host team of TJ and Erik. How are you guys doing?
Excellent. What's going on, Mark?
Oh, not much.
How you doing?
But we've got Rob Patten, a long-time guy around town, Portsmouth. I've known him a long time, but he is the co-founder. I mean, you guys started together with your partner, Patrick Marshall. Rob is the co-founder of Stratacuity, which I guess is really, as I would describe it, a placement agency for scientists, or medical professionals would be kind of the category I'd put it in.
Yeah. How do you find these cats, not being a pharmaceutical dude and I mean, your background's, you're not like a compounding chemist or anything.
I can't tell you that. I'm sorry. No, today it's a lot different.
But it's a niche market. I mean, it's not like, there's a show or something I think you would go to, but I mean, and you don't have a background in this, do you?
That's
I mean,
right.
Pharmaceutical or compounding and all that type of stuff.
That's right. In the absence of LinkedIn, right? Well, not to sound too old, but when I started, we were faxing resumes. And in fact, there was one client that wanted us to mail resumes to them via snail mail. So the technology's kind of accelerated, but literally back then,
slightly.
We looked up biotech companies online, and there were industry organizations like the Mass Biotech Council, and we'd find a company that sounded, good, Biogen. Vertex and
sounds like right in our wheelhouse.
Yeah, exactly. Oh, this is perfect.
But something with biology.
We looked at job advertisements, and this sounds really archaic, and I guess it was, but we'd see a bunch of advertisement for medicinal chemists, and that was it. So we'd go out and we'd talk to as many medicinal chemists, and the way you'd find them at the time was right around 5:30, the switchboards would shut down. And you could take a 50-person company and just do what we called reverse dialing. And so there were a lot of night times invested where you just sit there with a pad of paper and a pencil, and you'd get to the phone directory, and they'd say, sorry, we're not here right now. For a dial by name directory, press pound. You press pound, and then if you notice on the keys on the phone, there's an alphabet. You hit the number 2, and it would start listing everybody with the last name beginning A. And then it would go to the B's, and then it would go to the C's.
Yeah.
And the next day, when you built your list, you would come in and you'd start calling people. And the thing that I think separated us was that we weren't calling them to say, what can you do for me right now? We've always been of the mind that we wanted to develop a relationship with people. And you have to have kind of a long-term mindset to get into conversations with people that really, you're kind of taking them out of what they're doing. And one of the first things we did was because we realized the business was so different than high tech, no offense to the high tech people in the room, but these people really, we found, generally cared about making a difference. And
we don't.
You don't care.
I like the fact that back you did real forensic level work to get people.
That was awesome.
You couldn't get a 25-year-old to do that right now. You're like, I want you to call in and get a pad of it, right? They'd be on Evernote on their Samsung.
Right now we pay to get huge dollar LinkedIn subscriptions, but we also do a fair amount of sourcing still because there's you have to be able to find truly the best people. So there's a lot of referralizing and asking questions. The first search we had was actually for an executive level person within a company called Altus Pharmaceuticals, and they made
they were a client.
That's right.
Yep.
That's right. Well, they made an enzyme replacement therapy that it's still out there somewhere in a different company, but that would have been a product.
So basically, these companies get 10 or 15 or $50 million to go build get a drug out.
And they need rock stars. It's like building a baseball team, I would think. I mean, they got to go 0 to 100 pretty fast.
I'm curious though on companies that you have, you caught them early, put some people in there. They went through the process, developed something. I mean, what are the diseases? What are the things that you've had the biggest impact on? Sure. That you feel like personally, you helped build that company, and therefore, they came out with these drugs and came out with these.
You're gonna say Viagra, aren't you?
They put the full court press on that one.
It's,
so to speak, all pun intended.
Yeah. To understand the answer to that, I think you have to understand how complex the drug development process is. So it's kind of like this. It'd be difficult to pin the success of a drug on one person, let's say.
Mm-hmm. Yeah.
However, I do know this. If you put the wrong person into a position, they can be the influence for a failure. So in the example that I gave you earlier, they believe that they just got the dose wrong. And so I'm not kidding. I had a conversation with these people about what they were doing for clinical pharmacology. And we were going to market a guy that I've placed twice now. And what he does is he looks at how much drug gets into the body and over time what it does, the pharmacokinetic. The kinetic meaning what impact does it have when it gets in your body. And that is such a key part of what these people need to understand.
So fancy.
I know. TJ is like got this just cool. Impressed look on his face.
I do.
Yeah.
All right. Well, thanks again, Rob. We appreciate you coming in.
Yeah, thank you. I thought it was an awesome story.
Yeah,
so, and I didn't know all of that stuff about you and the firm.
So if you want to check them out, what's your website? It's stratacuity.com.
That's right.
Yeah. So if you guys and
Google it, it'll spell it right for you.
There's interviews with Rob, and you can check them out.
Strata.
Well, it's
in
not
the golf
often
ball.
that the three of us sort of sit back and listen, as much as we did.
You saying I talked a lot?
No, I'm saying
you just have really thorough answers.
Yeah.
So.
And anybody that can explain medical stuff in a way that I understand.
Yeah, what was the thing about when it goes into
pharmacokinetics, TJ?
Pharmacokinetics. I'm going to put that there. Can somebody text that to me, please?
Pharmacokinetics.
It's a kinetics with a K, right? Pharmacokinetics. I'm not kidding. I'm writing this down right now.
All right, well,
I'm going to use that, by the way. I'm going to use that before the end of the week.
You've been listening to Seacoast Business Connections radio show.
Thanks,
I'm
guys.
your host, Mark Miller, here with TJ and Erik, and we appreciate you guys listening, and thanks to Rob Patten from Stratacuity for being our guest today. We will be here next Monday, which is...